We are closely tracking outbreak zones of respiratory infections here in the U.S. Take a look at this. Hospitals in Ohio and Massachusetts are tracking this surge in pediatric pneumonia cases, dubbed white lung syndrome. So far in Ohio's Warren County alone, health officials are tracking 142 cases in children. And similar outbreaks are in China right now, leading 5 Republican lawmakers to call for a travel ban. We had former CDC Director Dr. Tom Frieden on the show this weekend and asked him if a travel ban on China is the right move.
Let's be really clear. Restricting travel may buy you a few days, maybe a week, to be better prepared. Nothing we've seen suggests there's a new pathogen that's emerged. And what are we doing now to get better prepared?
We want to welcome in now Dr. Christine Meyer on this topic. Doctor, thank you so much for joining us. Appreciate your time.
Thank you for having me.
First, do you agree with Dr. Frieden's analysis here? Would a travel ban on China help stop the spread of pediatric pneumonia within the U.S. at this point?
I don't think so. I do agree with him. I don't think there's anything to indicate to us that there is a new pathogen circulating in the U.S. that we are not ready for this winter.
What exactly is white lung syndrome, and is it tied to the recent uptick in pediatric pneumonia cases? Is it the same thing?
No, I think there's been a lot of miscommunication about white lung syndrome recently. So white lung syndrome is not even a medical diagnosis. It's basically a chest X-ray description of what lungs might look like in a patient who had pneumonia. The cases of pediatric pneumonias that we're seeing are due to many different pathogens. None of them are new. There are some viruses, there's some bacteria. So what we're seeing in the pediatric cases now can't be called white lung syndrome. It is cases of pneumonia that may present with an X-ray that looks white.
I understand. Why is it that we are seeing so many of these cases right now of pediatric pneumonia this season?
Well, first, let's be clear. We're not really seeing that many more than we would expect for this time of year. This is terrible, winter respiratory virus and bacterial infection season. I think, though, we should be prepared for maybe people getting generally sicker this winter and in the coming winters because of these dormant pathogens that we had over COVID. So we really got very lucky in past winter seasons with seeing very, very few cases like this. So now, this normalization of our case counts feels like a lot just because we've been so sheltered in the past couple of years.
A recent poll found nearly a quarter of Americans are skeptical of CDC recommendations following the pandemic. The CDC has said that this is not a new pathogen, like you said. They are monitoring China, but they are not overly concerned with all these images and video coming down of their packed ERs. How concerned are you that these statements from the CDC are falling on deaf ears when it comes to American trust in our medical system?
Yeah, I think it's a terrible thing. I think that the American public has lost faith in science and doctors and the CDC over the past several years. But I think it's really important to just keep sight of the fact that, data is data. And at this moment, there is no data to suggest that this pathogen, there's one new pathogen coming from China or anywhere else. I think if you really look at the cases in detail, there's nothing terribly alarming about any of them, whether in Ohio or Massachusetts. These kids have very common pathogens. Many of them are recovering fine at home, aren't needing to be hospitalized. And a lot of times these pneumonias aren't even being treated with antibiotics. They're just viruses that get better on their own. So I think while, everyone is a little bit skeptical of the scientific community lately, we really just have to get back to the basics and look at the data of the situation at hand.
I appreciate that. Many Americans have stopped using pandemic-era precautions like masks or social distancing. For those or parents who are concerned about white lung syndrome or pediatric pneumonia, what suggestions do you have?
Well, first of all, I think masks will protect you against any type of upper respiratory pathogen. So if you're worried and just simply don't want to get sick, like if you don't want to get a cold, you're, perfectly justified to wear a mask. I would say to parents, just remember that kids get sick. Kids who are around each other get sick from each other. I think the really important thing to do, though, is recognize when your child seems to be sicker than you would expect them to be for what they have. So children that have a high fever or a cough or shortness of breath, it's always a good idea to have them evaluated by their pediatrician.
All right. Dr. Christine Meyer, thanks for coming on the show tonight.
Thank you so much. Thanks for having me.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.